Okay, so we offer a number of different services on the schools programme. These include staff training, so safeguarding and prevention training for all staff members. We also do student awareness sessions. They go from year 5 all the way to year 13, and we also do some universities as well. We offer parent sessions. We offer youth-friendly resources. Now, of course, when you're dealing with something as sensitive as FGM, you need to tailor the content of your lessons to make it age-appropriate, to make it sensitive. So yeah, we have 2 very different lesson plans for the different age groups.
When we're thinking in terms of prevention, teachers are very well placed to pick up potentially risky situations, to identify children who may be at risk, and then they can take steps to prevent it happening in the first place, which is good. But there's also a space as well for support on the other side. So particularly with older students who have undergone FGM and may need access to support, maybe emotional health, maybe physical help. So teachers are very well placed to pick up those cases as well. Also space in terms in general of with schools in terms of opening up discussions, normalising discussions around genitals in the body. Teachers themselves need to be comfortable doing that. So training staff partly is letting them know appropriate responses, appropriate reframing, how to work with young people on these issues. In case they do receive a disclosure, they're ready to respond appropriately, so sensitively, effectively.
I think what's really important about the sessions is that we never go in telling people how to feel about it or telling people how they should behave. It's a space where they can explore the issue for themselves and come to their own conclusions. But the point is you encourage those conversations to be had in the first place.
Encouraging young people, particularly young girls from BME backgrounds, to prioritise their own health, to realise that their body matters, their health matters, they matter, and that they don't have to suffer. One of the things we do on the youth programme is when you get this passion from young people after they've learned about the issue or after they've really started thinking about it, is you want to channel that passion, channel that energy into campaigns. So the school's resource pack, it is a literal physical pack. It's got a number of resources in it for schools. It's particularly at the moment for secondary school teachers who want to themselves deliver sessions to their students. So it's really comprehensive. It's thinking about before the session, there's a section what needs to be considered before you run a session like this, how do you run the session, and how do you deal with the aftermath. It's PSHE Association quality assured. And we know from using it ourselves, working with over 21,000 young people across the country, that it's a very effective tool. If the school wants, we can come in and deliver some sessions and they can shadow us, see how we put it into practice. We also have an animation that's 2 presenters based on me and Rasha presenting it so that they can see how it's done. And we also offer a train the trainers, so that varies depending on who's requesting it, but it trains people to use the lesson plan and also how to run a session. So it's very critical to make these sessions relevant. So it's not just this is FGM, this is something that happens elsewhere, it's very much this is happening here.
We don't deliver everything just us two, no. We have a bank of sessional facilitators that are employed by Forward, and they deliver sessions on our behalf. So we recruited people that were interested in schools work and also in the campaign to fight against FGM. So we spent 3 weekends training them up, first of all just giving them the awareness raising session that we deliver to students and to staff members. And then we taught them facilitation skills.
We have 2 wonderful organisations that we worked with. One in Manchester, known as New Step for African Communities, NESTAC, and in Birmingham in the Midlands, Muslim Women's Network UK. So it was through them. We worked together in a partnership.
So thinking about who's going to be in the classroom, whether you deliver to boys and girls together or whether you deliver them separately. Thinking about the size of the class, a lot of schools will maybe want us to come in and do an assembly, and that's maybe not. You have to think about whether or not that's the best setting to talk about something like FGM, or whether maybe you have a smaller group of 20 individuals or 30. So the logistics as well, having particular teachers in the classroom, so that the students themselves are comfortable, because you as an external facilitator should never be in that classroom by yourself, for example. So yeah, thinking about those kind of things before you actually go in.
You have to know related topics as well, because talking about FGM, if you're successful in creating a safe space, is likely to open up a lot of other conversations that young people want to talk about but have not felt safe to do so with an adult before. So you'll get thrown questions that aren't actually related to FGM, but they'll be to do with relationships, sex, bodies in general, that sort of thing. But forward, we have an ethos in schools of always assuming that there is a girl affected by FGM in the room. So we stay very, very neutral. We're very clear that FGM is harmful, but we don't use terminology such as FGM is wrong, because that's a judgment, a moral judgment, and it's for them to come to themselves. Equally, imagery, so being mindful of using too explicit imagery. So people tend to like blood blades, blood splatters, sometimes images of girls being cut, and sometimes, unfortunately, videos of girls being cut that they found, and it's just completely not appropriate for the classroom whatsoever. If a young woman in the class has undergone FGM, this sort of imagery can be quite triggering, so it can bring back bad memories. Another thing you have to consider when running an FGM session is the issue of confidentiality. So it's a fine balance you have to strike between encouraging young people to feel safe to talk to you, but being clear that if they say anything that concerns you, if you become concerned about their well-being or the safety or well-being of anyone else related to them, you can't keep that a secret.
It can be very, very daunting to be giving all this information and then actually there's no space for them to get support if they need it for themselves or maybe somebody that they know. So ensuring that they know within their school who they can go to for help.
Sometimes, and I'd say more commonly, it's young people picking up leaflets for their mothers or aunts, or saying, well, you know, she's undergone it, it may have stopped with that generation, but there's still a place for her to access support. We've picked up a lot of our youth campaigners through the school's work, through maybe doing outreach tours, through maybe after sessions. So we see that it's actually making a difference. We can see these conversations being triggered. One of the primary schools that we worked in, we did some parent sessions with the mothers and fathers, and then a month or so later we went in and we did the sessions with the year 5s and then the year 6s. The teacher said, there's a little girl who was in your year 5 class, one of your year 5 classes yesterday, and she wants to speak to you and she'll only speak to you. And she said, oh, I just wanted to tell you that I knew about the issue already that we were talking about yesterday, because my mum went to the parent session and afterwards she came home and she told me she had had it done. But it had really hurt her, so she wasn't going to do it to me. And then she said, I think it's time we call Grandma. So the mother called her own mother, brought her round and had a conversation. When we spoke to the mother later, it was the first time she'd ever spoken to her Grandma about what Grandma had done to her. It must have been 30, 40 years before. It was the first time they'd had this conversation, the first time she said, actually, that really hurt me. And so what you're seeing there is the way we like to think about it is cascading information. So you start with the conversations, opening these conversations in your school's work, but it cascades outwards into the community. There needs to be continuous, sustainable funding. There needs to be not just funding that lasts for a year. We need to you're not going to make huge amounts of change. You're not going to end a practice that has been going on for literally thousands of years in a year. What you also need is specialist services for young people.
We know that FGM is not going to stop with a few people at the top shouting out about it. We know that we need to get as many people on board, and if teachers are another way to do that, when we know that so many young people are in their care for a sizable portion of the day, every day, it's an amazing feeling to think, well, actually the people that are in charge of safeguarding young people, they're confident to do so.